If you have just started treating leg spider veins by microsclerotherapy and you feel you need more help and guidance, this video is for you. I will take you through the essential steps to success, and I will help you avoid the mistakes that beginners new to microsclerotherapy often make. I'll give you 7 don'ts. Now, before we dive in, let's be clear. Microsclerotherapy is the best treatment for leg spider veins. Studies have compared laser and electrocoagulation, and microsclerotherapy always comes out best. It involves the precise injection of a prescription medicine called a sclerosant into the leg spider vein, and this is followed by a healing process, and the spider veins fade and disperse. Essential steps towards successful microsclerotherapy are a thorough, well-documented consultation, careful selection of people suitable for microsclerotherapy, precise injection technique, support for your patients during the healing phase, and assessment of results and the possible need for further treatment. So here's the first don't. Don't overpromise. During the consultation, explain that microsclerotherapy is not perfect. No treatment ever is. About 80 to 90% of people are very pleased with the outcome, and they are satisfied with the final results of microsclerotherapy for their leg spider veins. However, up to 15% of people may be disappointed because the results do not meet their expectations of improvement. During the consultation, be very careful in your use of language. Use terms such as fade, improve, and less noticeable. Don't use terms such as disappear, go away completely. Don't number 2. Don't choose the wrong people to treat. When selecting people for microsclerotherapy, be sure you know the indications and contraindications. Select healthy patients who you can expect will heal well. Select those with isolated spider veins that are easy to see. Avoid those with health problems and severe allergies who may not heal well or who may react adversely to the sclerosant. As a beginner, avoid treating very fine spider veins that are difficult to see with the naked eye. Not only are these vessels difficult to inject, but these patients may have extremely high expectations that you will find difficult to meet. Don't number 3. Don't ignore blebs. Successful injection results in blanching of the vessel. Injection outside the vessel is called extravasation. Now, when you start, blebs may occur frequently. Be sure you recognize both blanching and blebs and always stop injecting if the patient experiences pain or if you cause a bleb. Don't ignore discomfort and don't ignore blebs. You risk causing a scab or an ulcer. Watch the tip of the needle at all times when you're actually injecting sclerosant, or you will miss the bleb. Don't number 4. Don't inject too much sclerosants. Beginners often inject large areas of veins in one injection. Instead, inject small volumes, slowly and under low pressure. As a beginner, avoid strong sclerosants and blanch small areas of the leg veins at one time with multiple injection sites. Don't number 5. Don't forget to explain what happens after microsclerotherapy. Patients must be informed that their leg veins usually look worse during the healing phase, so avoid injecting just before important social events when the patient's leg might be on show. Warn your patients about this and tell them that their spider veins may need more than one treatment session, and make sure that your consent process is well documented and that written aftercare advice is given to your patients with the information about how they can contact you if they're concerned. Be sure that your patients know what to expect after treatment before you actually start the treatment. If complications arise, make sure you can recognize them. Don't number 6. Don't inject too frequently. Instead, leave sufficient time for the healing process before making a judgment about the need for retreatment. Leg spider veins may continue to fade for 3 to 6 months after injection. don't retreat within 6 weeks, and if in doubt, leave more time for healing. Number 7. Don't forget to take photographs. My final tip is to always take photographs. You and your patients may forget what the veins initially looked like, and after reviewing photographs, you and your patients may be pleasantly surprised how good the improvement after treatment actually is. In the description box below, there's a link to my free mini course, How to Inject Leg Spider Veins and Blue Veins by Microsclerotherapy, where you'll find more tips for successful injections. If you found this information valuable, please consider hitting the like button. It really does help my channel, and check out all the links in the description box below. Why not leave me a comment or a question? I really do look forward to reading all of these, and I promise I'll get back to you as soon as I can. I hope to see you again soon, so don't forget to hit the subscribe button, and that way you won't miss my next video.